Hi, it's a nursing professor here. I want to talk to you today about using a concept map. This is a very valuable tool for you to use in order to incorporate all of your topics, all of the subject matters that you need to know in order to manage a particular disease. So for today, we're going to take the example of diabetes, okay? So in the main topic, we would have managing the patient with diabetes. That would go here. Over here, we would have a nursing diagnosis. Now, this nursing diagnosis is going to depend on what this person is presenting with. So let's go back here to symptoms. So symptoms could be polyuria, polydipsia, slow healing wound, blurred vision, fatigue. Okay, so let's take that slow healing wound as being the symptom of this patient. Nursing diagnosis related to that could be alteration in skin integrity, right? All right, so then we come down here to the various types of diabetes, and we're going to talk about three. So one is type 1. That's when that pancreas is not working at all and that person has to take insulin. Type 2 is when we call it adult onset diabetes, and person may be managed with diet, exercise, a pill, or insulin. And then we have gestational diabetes that happens to many women that are pregnant, especially in advanced age. And so when we look at those various types of diabetes, we're concerned about the same thing, that pancreas is unable to secrete the amount of insulin necessary for that person to manage their blood sugar. All right, so let's come here to complications, because these complications will happen if the diabetes is poorly managed. And so complications can include diabetic retinopathy. People can go blind from that. Neuropathy, we hear people complain of pain in their hands and their feet in particular. Kidney insufficiency or kidney failure. And cardiovascular disease. All of those could be complications of poorly treated diabetes. So what are we going to do about that? Because we know that there's many people who have diabetes and we don't want them to suffer. So we need to come up with interventions. So these are things that we're going to do for our patients in order to help them manage their diabetes. So number one is educate. We're going to educate them how to take their blood glucose levels, let them know what is high, what is low, how to journal and keep documentation so the next time they see their provider, then they can have a discussion on that. We can teach them about diet and exercise and regulating their weight. We know there's a correlation between elevated glucose and poorly managed weight. We can teach them about foot care because we know that that's a very vulnerable spot for a person who has diabetes. And any types of symptoms that they may have that we talked about here, we can talk about how to manage those. So education is number one. Next is going to be any type of medications that they've been prescribed. So PO meds might be something like glucophage or glipizide. There's a host of them, and we know all about the ones that are creating this weight loss craze. So they work. They do work, but they do come with side effects. So we want to make sure our patients understand those. And last but not least, we want to make sure that our patients understand the types of insulins that they may be prescribed. And there are various ones. They go from the rapid acting that act within 15 minutes. Example would be your Humalog or your Novolog, all the way to your long-acting insulins, which really last about 24 to 36 hours, and that's more like your Lantus. And so I would tell you that you should make yourself a chart, make yourself index cards, medication cards, whatever you want to call them, and learn each of those insulins, because many times you have to understand that information in order to answer a test question. So I hope that helps as far as managing a disease. Let's just try one more before I leave. What if this was respiratory? Person had a respiratory disease and say they had COPD. So we know a person that has chronic obstructive pulmonary disease has difficulty breathing at times, and they may have like a chronic cough. So a nursing diagnosis for them could be alteration in breathing or chronic cough, because those things need to be managed. Symptoms of that could mean that this person has shortness of breath when they ambulate or when the disease process has been exacerbated. They could have difficulty breathing, especially with exertion. Types of COPD would be many, including asthma, bronchitis, emphysema, all of those would go there. Complications of respiratory problems include fatigue, include damage to the lungs if it's not treated, dyspnea, difficulty breathing, using many pillows like orthopnea. We know all of that could be potential complications. And interventions, of course, could be education. We always want to include education. We want to teach them about how to use their inhalers, to use spacers with their inhalers, and any type of PO medicines that they may possibly have. All right, so I hope that helps. Try to use this when you're learning your disease management, and let me know how that works out for you. Bye for now.